Sir, we are live.
Good afternoon, everyone. On behalf of NASH 24/7, I welcome you to our public awareness program on how to tackle fatty liver. NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To break the silence on NASH today, we have a renowned gastroenterologist from Jaipur, Dr. Manoj Yadav. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Manoj is a leading gastro in Jaipur, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Rangta Hospital, Adinath Hospital in Tilak Nagar, Jaipur. He is working as a consultant gastroenterologist there. So, sir, on the occasion of International NASH Day, we salute your dedication towards spreading awareness related to liver health. Now, I would like to invite Dr. Manoj to enlighten us on the topic. Over to you, sir.
Thank you so much, Lakhanji, for this opportunity and this kind introduction. Today, I will discuss about the non-alcoholic fatty liver disease, how to fight this, and how we can prevent this, and if there is need of treatment, then how can we treat this. Next slide. Okay. So, some information about the International NASH Day. It was initially launched in 2018 by Global Liver Institute and is celebrated across the globe on second Thursday of June month. And the goal of this is to raise the awareness about the non-alcoholic steatohepatitis and the actions people can take to prevent the disease. And the theme for this year is to step up for NASH. This year, GLI is inviting all to step up for patients, step up for early detection, and step up for advocacy to defeat non-alcoholic steatohepatitis. And Zaitus has been official partner of GLI to do various awareness activities around International NASH Day, and Zaitus has been celebrating 6th International NASH Day this year. Uh, Coming to some basic about the liver. The liver is the second largest organ of the human body and weighing around 1500 gram, 1.5 kg with 5% of fat. And it is located in the upper right portion of the abdominal cavity on the top of the stomach and intestine. It is in healthy state is pinkish brown in color, soft with soft consistency, and is highly vascular organ. The function of the liver, some common function is one is to destroy the old RBCs and to process the nutrients which we eat through our food, and to regulate the blood compositions, to produce biles, and to produces protein and cholesterol for body requirement. And it controls around 500 of the metabolic process which are going continuously in our body, and it breaks down alcohol and other medications, and it also help in detoxification of the blood. Now, understanding the NAFLD, the non-alcoholic fatty liver disease is a condition in which fat makes up more than the 5% of the weight of the liver, and it is not caused by the alcohol use. And if it left untreated, then slowly it can progress to the non-alcoholic steatohepatitis. Being overweight or obese, having type 2 diabetes, having high cholesterol are associated with the increased risk of non-alcoholic fatty liver disease. Talking about the prevalence of the NAFLD, around 1 out of the every 4 people have NAFLD, regardless of the weight. Meaning, it is not necessary to being overweight to have NAFLD. Patients with lean, thin patient can also have NAFLD, and more than 6 diabetics and 9 severely obese people are out of 10 have NAFLD. The male gender has been regarded as a risk factor for progression to NASH and fibrosis compared to the female. Now talking about the progression of the NAFLD, on left this is the healthy liver, which is pinkish, which slowly progress to the fatty liver due to deposition of the fat, and slowly, if not controlled with time, it can lead to the liver fibrosis, in which scar tissue forms more liver, leading to the liver cell injury, and over the time gradually leading to the cirrhosis, in which scar tissue destroys the whole liver and liver is unable to work properly. Now, what is the difference between non-alcoholic fatty liver and non-alcoholic steatohepatitis? Basically, non-alcoholic fatty liver is only the fat accumulation in the liver, and non-alcoholic steatohepatitis is the fat accumulation plus inflammation and scarring. The fat accumulation liver is also known as steatosis. Steatosis will lead to the inflammation in hepatic cells and is known as the non-alcoholic steatohepatitis. And scarring of liver on benign stage is also known as the fibrosis. Now, what are the some common causes of NAFLD? One of the most common cause is the obesity, and other is genetic background. There is if there is some family history or there is some enzyme effect since birth that can lead to the NAFLD, and intake of food like oily food, fat food with highly trans fat, and increased sugar intake in the food can also lead to the fatty liver. And metabolic syndrome, the metabolic syndrome is basically it comprises of diabetes mellitus, hypertension, low HDL, high triglyceride, and high again the obesity. These all if out of them three are present, then it called as metabolic syndrome, which also a cause of NAFLD. And others are being exposed to certain medications and physical inactivity or sedentary lifestyle, which also can lead to the NAFLD. Now, obesity and fatty liver disease. Being overweight or obese causes fat to accumulate in the liver, and obesity increases the amount of fat to constitute 5 to 10%, which in turn lead to the non-alcoholic steatohepatitis and scarring of liver, which already discussed, also called as the cirrhosis of the liver. What are the association between NAFLD and diabetes mellitus, which is generally a bidirectional association? A threefold increased risk of death due to cirrhosis and increased risk of NASH in patients with diabetes, which is having NAFLD. And patients with NAFLD generally have high prevalence of diabetes and 2 to 4-fold increased risk of developing the diabetes over due course of time. Now, what are the symptoms of NAFLD or non-alcoholic steatohepatitis? Many people with NAFLD do not have any symptoms. It is a silent disease, but in those who do, these are usually non-specific, such as patient may have mild fatigue, weakness, or discomfort or pain in the right upper abdomen. And these are the some other symptoms of once patient of NAFLD progress to cirrhosis. There is development of other symptoms like there may be abdomen distension due to ascites. There can be varicose bleed, and there can be kidney dysfunction, or patient may land up to the HE. Patient may become unconscious. Next. Now, how can we diagnose NAFLD? Fatty liver can be a silent killer, as already discussed, because the progression of disease is very gradual. And the diagnosis of NAFLD often involves the following. We can do blood test, the liver enzyme like SGOT, SGPT, and with ultrasound and fibroscan, we can diagnose NAFLD, and we can rule out the presence of fibrosis. And one of the invasive method is by liver biopsy, and other are X-ray and CT scan and MRI of the abdomen. Most common blood tests done are SGOT and SGPT, as I already told. The persistently elevated ALT can be associated with disease progression, and patient with normal ALT can also develop progressive disease. Up to 80% of NAFLD patients can have normal ALT, and there is no designated ALT cutoff for prediction of NASH or advanced fibrosis in NAFLD patients. And using the following blood test, varying scoring method has been established. One of them is FIB4, in which age, AST, ALT, and platelet count are used to calculation of the FIB4 score. And other is NFS, NAFLD fibrosis score, which comprises of age, AST, ALT, platelet count, BMI, fasting glucose, and albumin. These scoring methods have been established to diagnose more better than AST and ALT alone, and online tools are available to calculate these scores. You can enter values from your blood report and generate the score to understand the risk of NAFLD. Now, what are the non-invasive method of diagnosis of NAFLD? One of the most common method is by ultrasonography, in which fatty liver may diagnose, and it is easily available, economical, and it is the most common reason for accidental diagnosis of NAFLD. But there are some drawback of this test. This that this only detects only 25% If there is more than 25% of fat in the body, in the liver, then it only can detect, and it cannot differentiate between the fat and fibrosis in the liver. And there is another emerging non-invasive method of diagnosis of NAFLD is transient elastography, commonly known as fibroscan. It diagnoses NAFLD with fat more than 10%, and it can differentiate between fibrosis and fat content in the liver, and it is easy to operate. The drawback is misinterpretation in obese patient. Obese patient require the use of the different probe compared to the non-obese patient. Then, because of that, there may be the false value. Now, what is transient elastography or fibroscan? Liver scan works on the principle of transient elastography. We get two different values from this, including one is LSM, liver stiffness measure. LSM indicate the degree of fibrosis in the liver, and other is the controlled attenuation parameter, which indicate the degree of steatosis or the amount of the fat in the liver. Another non-invasive method of diagnosis of NAFLD is MRI proton deficient differentiation fat fraction, which is a gold standard to detect the fat content, and it can measure fat content up to more than 1% in the liver, and it is widely used technique for liver donor patients. But the drawback is it is not widely available and is one of the costly investigation for the diagnosis of NAFLD. Now, coming to the invasive method of diagnosis, as I already told, the liver biopsy is the invasive one, and this is the gold standard method for diagnosis of NAFLD NASH, and it is the only method to diagnose NASH and rule out other liver disease. These are the advantages and some disadvantages. It is painful procedure, and it is individual dependent, and chances of misdiagnosis in early stage of NAFLD is there with liver biopsy. Now, talking about the natural cycle of the NAFLD or the progression of NAFLD, out of the total patient of NAFLD, 70 to 75% of patient develop isolated fatty liver, which none to very minimal fibrosis, and there is no risk of increased death compared to the general population. But in some patient, fatty liver develop with mild inflammation. There is chances of progression of the NASH in such type of patient, and out of the total NAFLD patient, 20 to 25% patient develop NASH, and there is increased risk of death compared with general population in NASH patient, and there is other morbidity like cardiovascular malignancy and liver related. NASH with fibrosis present worse prognosis, and fibrosis progression associated with diabetes mellitus, insulin resistance, weight gain of more than 5 kg, and rising of ALT and AST. NASH, out of total patient, 11% of NASH patient over 5 years develop into the NASH cirrhosis, which in turn lead to the complication like hepatocellular carcinoma in 7% of around 7% of patient over 6.5 years, and can lead to the cirrhosis with decompensation in 19 to 45% of patient over 7 to 10 years. In NAFLD, we should act before it's too late. The non-alcoholic steatohepatitis is a more serious form of NAFLD in which you have scarring of liver. NASH may lead to the cirrhosis or liver cancer. And progression of NASH, as I already told, can lead to the increased risk of heart-related disease. Severe NASH is generally not reversible. So we should treat as early as possible since the diagnosis. Now, what are the treatment options? As I already told, one of the reason for NAFLD is obesity. So we should avoid obesity or excess weight. First of all, in which we can modify our diet. We can decrease the calorie intake. We should increase the intake of fruits and vegetables. We should avoid trans fat containing food material. We should avoid increased sugar intake. And other one is exercise. We can do aerobic and anaerobic both exercise. Aerobic exercise like swimming, jogging, walking we can do, and anaerobic exercise like in the gym, weightlifting and dumbbells we can use. And lifestyle modifications like we should avoid smoking, alcohol, and excess stress. And there are some new medication which we can start in patient with NAFLD. Speak to your doctor about the treatment options. For treatment, NAS, NAFLD score, and can also go for fibroscan. On the basis of them, doctor can start your treatment and can lead to the improvement. As I already told, one should control weight gain. With the help of combination of hypocaloric diet, moderate intensity exercise, provide best likelihood sustained weight loss, and weight loss of at least 3 to 5% body weight help to improve the steatosis, and weight loss of around 7 to 10% to improve majority of histopathological features of NASH, including fibrosis and inflammation. Now, this pyramid shows the weight loss effect on FLD. If there is weight loss of more than 3% or equal to 3%, there are chances of improvement in the steatosis around 35 to 100%. And if there is weight loss of more than equal to 5%, ballooning and inflammation decrease in 41 to 100%. And if there is weight loss of more than or equal to 7%, NASH resolution can seen in 64 to 90% of the patient. And if there is weight loss of more than or equal to 10%, fibrosis improvement seen in 45% of the patients. Now, this diagram shows the diet for healthy liver. This include weekly moderate portion of poultry, eggs, cheese, and yogurt, and every day one should eat base each meal around vegetables, fruits, whole wheat, grains, olive oil, beans, nuts, legumes, seeds, herb, and spices. And less often one should use red meat and sweets, and often twice each week fish and seafood one should eat. Type of exercise I already told. Aerobic include reduce liver fat, maintain healthy weight, and improve cardiovascular conditioning. And resistance exercise reduce liver inflammation, improve glucose absorption and insulin sensitivity, improve metabolic parameter with less energy consumption. And with this exercise and dietary modification, gradually fatty liver improve to the again normal to normal liver. Now there is some lifestyle tip to take an NAFLD and NASH. Develop an exercise routine and stick to it. Get enough sleep of around 7 to 8 hours. Get enough vitamin and minerals with the help of fruit and vegetables, antioxidant. Get regular medical checkups. Eat small, frequent meals and lower your sugar intake and trans fat intake. Now coming to the pharmacological approach, as per the recent nasal guideline, only three molecules recommended for the NAFLD. One is vitamin E, other is saroglitazole, and other one is pioglitazole. The vitamin E recommended in NASH with or without fibrosis in non-diabetic adults. The patient with diabetes should avoid vitamin E, and pediatric patients should avoid. And it is recommended for total duration of 2 years. Talking about the saroglitazole, in patient with NASH with or without fibrosis in both diabetic and non-diabetic patients. So this is the advantage with the saroglitazole that we can use in both diabetic and non-diabetic patient. And currently it is recommended for the 1 year of total duration. Another drug is pioglitazone, which is also recommended in NASH with or without fibrosis in both diabetic and non-diabetic patient. It is recommended for the 2 year of the duration. Now, there are again some tips to prevent fatty liver disease. As I already told, this is the disease which we can prevent. And but if once there is progression from NAFLD to NASH and severe fibrosis, then we cannot reverse the fibrosis. So best is to prevent this disease. Now, what are the tips? One is the limit intake of saturated fat and trans fat, as I already told. Quit smoking, eat a balanced diet with fruit, vegetables, antioxidant, exercise regularly, either aerobic or anaerobic, and limit consumption of refined carbohydrate, limit or avoid alcohol intake, maintain a healthy weight, and take medicines as prescribed by your doctor. Thank you.
Thank you, sir. Thank you so much for this wonderful talk. And now, with your permission, can we take some questions from the audience?
Right, right.
Right. So we have one common question from our audience that is there any cure for fatty liver or is it reversible?
Yeah, as I already told, fatty liver is quite reversible, and depending on the level of the fat or inflammation in your liver, you may or may not require the pharmacological treatment. And best is to the weight and eat a healthy diet. And if one have diabetes or hypertension, and one should control diabetes and hypertension, so there is less chances of the fatty liver progression, and it may be reversed to the healthy liver.
Right. So as this fatty liver, non-alcoholic fatty liver disease is asymptomatic disease.
Right.
So our viewers want to know that how they will get to know that they are having NAFLD and what are the symptoms and when should they go to a doctor, when should they visit a doctor?
Very good question, and it is the most common question asked by the patients or patient's relative. And if one have the risk factor for the fatty liver, like one have diabetes, hypertension, high cholesterol, obesity, and if then one should consider to go to the doctor. And as I already told, most of the patients are asymptomatic, but common symptoms are heaviness or pain in the right upper abdomen, easy fatigability, weakness. So these type of patients should go to the doctor and look for the fatty liver. And if there is presence of fat, and so progress accordingly, and took treatment if required.
Right. So, as Dr. Manoj has mentioned already, that there are some risk factors. Along with that, if you feel any symptoms like fatigue and all, and then you should definitely go to a doctor. So, Doctor, I want to ask one another question that a patient says that I am having grade 2 fatty liver in ultrasound. How I can avoid having NASH?
Again, the same thing. First line of treatment or advice is to lose weight and eat a healthy diet, and control your diabetes, hypertension, and obesity. And in grade 2 fatty liver, one should go for the fibro scan to assess the level of the fibrosis. And depending on that, one should start the pharmacological treatment if indicated. And with that, we are able to reduce the level of the fibrosis. And as I already told, the saroglitazole is recommended by the inazal. So this is a wonder drug, I can say. And it can reduce the level of the NASH to grade 3 to 2, back to the 1 and normal healthy liver.
Right, sir. Thank you so much, sir, for this enlightening talk and taking the questions from the audience also. So, I would like to thank you from the behalf of Nash 24/7 also. And along with that, I will request my viewers also that and the patients also that they should definitely go and visit the doctor on time and they should take their medications also. And again, thank you to
Right.
our audience also for being patient and conducting this Nash 24/7 live very effectively. So thank you everyone. Stay safe and keep your families safe also. Thank you, sir.
Thank you. Thank you. Thank you.